A dental bridge is a common dental procedure used to replace missing teeth. It consists of one or more artificial teeth, called pontics, which are supported by dental crowns on either side. The crowns are placed on the natural teeth or dental implants adjacent to the empty space left by the missing tooth. There are several reasons why a dental bridge may be used. The most obvious reason is to fill the gap left by a missing tooth. This can not only improve the appearance of the smile, but also prevent the surrounding teeth from shifting out of place. When a tooth is missing, the surrounding teeth may gradually move into the empty space, leading to alignment issues and potential bite problems. By filling the gap with a dental bridge, the remaining teeth are held in their proper positions. Another reason for using a dental bridge is to improve chewing and speaking abilities. When a tooth is missing, it can be difficult to chew certain foods or speak clearly. A dental bridge can restore the ability to chew and speak properly, making it easier to enjoy a wide variety of foods and communicate effectively. In addition to these practical purposes, a dental bridge can also help maintain the shape of the face. When a tooth is missing, the surrounding teeth may shift and cause the face to appear sunken or sagging. By replacing the missing tooth with a dental bridge, the natural shape of the face can be preserved. There are several types of dental bridges available, including traditional bridges, cantilever bridges, and Maryland bridges. The type of bridge used will depend on the individual's specific needs and the condition of the surrounding teeth. Traditional bridges are the most common type and consist of one or more pontics supported by crowns on either side. Cantilever bridges are used when there are only teeth on one side of the gap, while Maryland bridges are made of a metal or porcelain framework bonded to the back of the adjacent teeth. The process of getting a dental bridge typically involves several appointments with a dentist. During the first appointment, the abutment teeth on either side of the gap are prepared by removing a small amount of enamel to make room for the crowns. Impressions of the teeth are then taken and sent to a dental laboratory where the bridge will be custom made. In the meantime, a temporary bridge may be placed to protect the exposed teeth and gums. Once the permanent bridge is ready, the temporary bridge is removed and the new bridge is cemented into place. The dentist will make any necessary adjustments to ensure a comfortable fit and natural appearance. With proper care and regular dental checkups, a dental bridge can last for many years. In conclusion, a dental bridge is a versatile and effective solution for replacing missing teeth. It can improve the appearance of the smile, restore chewing and speaking abilities, and maintain the shape of the face. If you are missing one or more teeth, consider talking to your dentist about the possibility of getting a dental bridge. It could make a significant difference in your oral health and overall well-being.